So the World Health Organization has issued warnings about counterfeit forms of Ozempic. The diabetes drug, of course, has become so popular for weight loss. Bootleg versions of the drug now propping up all over the world, in Brazil, the UK, here in the US. WHO's warning these new fake Ozempics, essentially, could pose serious health risks. So let's talk about that. More on it with Dr. Decotiis, medical weight loss expert here in New York, who's here in our studio. So thank you, doctor, for coming in. We appreciate this. How serious? How big of a problem? Because a lot of people either are taking or looking into taking Ozempic, I assume, and then they get hit with these fakes. How big a risk?
This is such a great topic. People really need to know this. I practice in New York City. I see patients in New Jersey, Connecticut, Long Island, really all over the country, and everyone is complaining about scams with these medications. And a lot of them have been involved with these scams before they see me. So you don't know what you're getting. So this is the key. This is what people need to know.
Okay.
You don't want to get this medication online. You need to get it through a physician.
I mean, that's the first and foremost thing you would think in any medication. Make sure
exactly
that it's prescribed for you. And then do you always avoid these kind of scams?
Well, I think that if you're getting it from a physician, you're pretty assured that it's going to be okay. So you would either get the commercial product from a physician, or you can get a legitimate compounded product from a physician. And I prescribe tirzepatide, which is Mounjaro, and Zepbound. I also prescribe Ozempic, which is semaglutide, also Wegovy.
So just because it's not Ozempic, I'm going to put up the warning from the World Health Organization while we speak about it, and then just read about these falsified products. So these falsified products, they say, could have harmful effects to people's health. If the products don't have the necessary raw components, falsified medicines can lead to health complications resulting from unmanaged blood glucose levels of weight. So sounds like you're saying there are other options, not just Ozempic, there are other real options, but you got to be careful.
Correct.
Scams.
So again, when you're dealing with a compounded medication, you want to get it from a physician. If you don't know what's in it.
Yeah.
Some of these medications allegedly have had insulin in them. That could kill somebody. Or perhaps sterile water, or who knows what else is in it. So it's very, very dangerous. The other thing that you want to know is, even if you're using an online app, which is supposedly, one of these things that you see advertised on TV, some of them are legit, but you're not actually seeing a weight loss physician. And you're getting your care online from someone that's never examined you. And I think the success in my practice is not just prescribing really good compounded products like tirzepatide and Ozempic, but it's also following patients really carefully. They need to be followed on a body composition scale, where we make sure they're not losing muscle.
And what are the safety concerns? There's one, losing muscle, that you would have for Ozempic and other drugs that are normally, they're normally relatively safe.
Yes.
If you're prescribing them, is that true?
True.
So, but you do have concerns there that people have to be careful of just outside of the scam.
So if you're just taking it without getting on a body composition scale, you don't know how it's working. And the number one mistake that people make, and my patients out there are rolling their eyes, here she goes again, is not drinking enough water.
Yeah.
If you're not hydrated, you will burn muscle, because the body is afraid to burn fat, because fat is so much water. So you're losing water when you're losing weight. If you're drinking the water, then the body will selectively burn the fat and you'll save muscle. So any drug that promotes insulin, and these drugs, these GLP-1 drugs like Ozempic and Mounjaro and Zepbound, they're all promoting the way insulin works in the body. That's why they're such effective fat burners.
What about how much? They cost a lot, right? Sometimes I just read something, people paying like $900 a month. Is that right, or is that
at least maybe $1,200, $1,300
per month? So
or the commercial product.
Is that what's leading to all the scams? I mean, they try to get in and get you something a little bit cheaper. Or?
Yeah, I think that encourages people to look for something cheaper.
Yeah.
But again, they're going to sites that they might buy something from, and a week later, those sites are down. It's really scary. They're pulled off the web. People have even gotten fake medications on social media, which is really scary.
Let me ask you about one more thing before I let you go. That's the role of the government in all of this. I don't know what you think of this. This is a New York Times headline. In states that won't pay for obesity drugs, they may as well have never been created. It says public employees in the state of West Virginia who took the drugs, lost weight, and were healthier, and some are despondent that the state's canceling a program to help pay for them. What's your view on that?
The problem is that these drugs are very expensive, and they're not going to go off patent for probably another 20 years.
Wow.
So the state of West Virginia has a Medicaid program, right? And they get money from the federal government. It's also state money. family, they have to be able to afford it. They were saying that 40% of all their pharmaceutical costs were for these drugs. They had to cover other things, so it may not make sense for them to cover them. But my feeling is going forward, if these drugs are not used properly, patients will continue to take them forever and ever and ever. And that's going to give the insurance companies and the government a lot of cold feet. So that's why I advocate in my practice. I could try to get people off these drugs. And I do it by making sure they're actually losing fat.
Right, doing it the right way.
Doing it the right way.
Thanks so much for watching. Just go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.